Alright guys, so we have Lani here and we're going to go through some beginner cycling with her. This is going to target the aerobic system. Okay, so as you can see, she's pedaling away, making sure that she pushes through the heels and that her knees aren't fully locked out, so she's not extending her knees out. Adaptations that are likely to take place in this activity, if she does it regularly, changes in the heart. So regular training may increase the cardiac chamber size and expand her total blood volume, and over time her resting heart rate may become lower. Her muscles in her legs will increase the number of capillaries surrounding each of the muscle fibre. This increase allows for a faster exchange of oxygen and fuel between the blood and the working muscles. The downside, I guess the negative of doing too much cycling is that cyclists may decrease their bone density, as it's not a weight-bearing exercise. So try and mix it up with some resistance workouts. Over time and regular activity, her lungs, her breathing can become slower, and she could gain a larger tidal volume. Two of the major joints that are working are a coxal joint, or a hip joint, and the bones that are used there are ilium, a ischium, and a pubis. So at the concentric phase of this exercise is when her knees are at the highest point. So when her knee is up there is the concentric phase of the exercise. And the agonistic, or the main muscle being worked at the time, when her knee is elevated, is the quadriceps, so this front muscle here. And while that's up, the antagonistic muscle in the concentric phase is the hamstring. So that's not working at all. The quadriceps is doing most of the work. The joint number 2, as you can see, is her ankle joint, also known as the talocrural joint. Okay, and as you can see there, as she's pedaling, her ankle slightly moves along with the pedaling. Bones involved in this are her tibia and her fibula. Tibia being the one on the inside of her leg, and the fibula being the one on the outside of her leg. When the knees are elevated, as like so, the agonistic muscle being worked in the concentric phase is the extensor hallucis longus muscle, so the muscles on the front of the ankle here, and the antagonistic muscle, the one that's not being used as much, is the gastrocnemius, which is the muscles in the back of the calf. As she continues, you can see she's working in a sagittal plane of motion. And that is cycling for beginners.